Hello, welcome everyone to this education and training survey. My name is Paco Hernández from TransplantChild, and I'm going to present this survey that we are going to conduct in this year, because one of our objectives was to establish an education and training program for young trainees. We decided in the last board of TransplantChild that a young trainee is someone who have finished their residency or fellowship and is already working in transplantation. For clinicians, for the medical specialties, we consider 5-year training to be young trainees. After these 5 years, you are not longer a young trainee, and 10 years for the surgical specialties, because the training have some different characteristic. So less than 5 years working in transplantation for clinicians, and less than 10 years for surgeons. The first part of the survey is regarding the young trainee. You have to identify yourself with your email address and your transplantation center. This is only to avoid the repetition of the survey by someone. So we're not going to use this information for anything else. The first question is, how many years have you been working in pediatric transplant unit? Divided in 2 years periods. Less than 2 years, 2 to 4, 2 to 6. In the case of clinician, you already would be like a senior, or at least not young trainee. And for surgeons, it could be from 6 to 8 and 8 to 10 years. So this is only to know. This is only for us to know who are going to direct our training program. What is your specialty? We don't have all the specialties here, of course, but you have like the general specialties: transplant physician, transplant surgeon, anesthesiology, etc. If you have another one, you can select other transplant specialty, and you can specify later in the free text questions. What is your ENT background in transplantation? We are not asking here about your residency, about your fellowship. We are interested here only in the field of transplantation, specifically online courses, workshop, courses, fellowship, whatever, but referring only to transplantation. Your research background, again, only referred to transplantation. Participation in one research project, more than one, co-author of one peer-reviewed paper, more than one, or non-activity. The type of transplant that are performing or reviewed in your center, because some centers usually do the follow-up of the patient that are transplanted elsewhere. Both of them are valid here, either performing the transplantation in your center or doing the follow-up. You can click all of the options if you have them in your center: liver, kidney, heart, intestinal, multivisceral, lung, liver and pancreas is not, we are not meaning multivisceral here. There is another category. Liver and pancreas, we are referring to the type of transplantation that sometimes are required for example, for cystic fibrosis, bone marrow, cornea, skin, etc. And then the numbered questions refer to your priorities in the education and training activities that you will like to have from TransplantChild. First one, about which phases of pediatric transplantation would you like to receive extra training? Of course, all the divisions are artificial, but we found very useful this division of the period of transplantation from the beginning of TransplantChild, and we included it in our surveys and activities for 4 years already. Pre-transplant, transplantation procedure, and post-transplant. The transplantation procedure includes the surgical procedure and the stay in the hospital during this transplantation. The second question is divided in the specific topic of each of these areas: pre-transplantation, transplantation, and post. So in pre-transplantation, we would like you to specify the topics that you are more interested in. You can give a score from 1, less interested, to 6 to 7, sorry, most interested. Communication skills, family approach, ethics and legislation, indication and waiting list, donor management, living donation, and tissue procurement and processing and distribution. You can click on we would like you to click all of them from 1 to 7. In which of the following areas during transplant procedure would you like to see additional training programs? Again, but in this case, you have only 6 items: graft and organ manipulation, organ evaluation and surgical procedure, early complication, graft survival, intraoperative and immediate postoperative considerations, and no technical skills in critical situations. The same thing for after transplantation, for the post-transplant period. Again, we would like you to click and select the 6 options from 1 to 6, from the less interested to the most interested for you: immunosuppression, drug monitoring, infection management, acute and chronic rejection, donor and recipient chimeras in hematopoietic stem cell transplantation, and management of long-term transplant. 2D is referred only to the transplant research, in which you would like to have training programs. So this is not referred to the research activity you are already doing. This refers to the training that you will like to receive in the future from TransplanChild. Biomarkers and tolerance rejection prediction, new therapies, novel tools for tolerant induction, concepts of non-clinical and translational research, European platforms, and funding from the European Union calls for research. Again, from 1 to 6, from the less interested to the most interest for you. Number 3, which biotechnological or medical areas are you interested in? Surgical procedure, PCR, microbiology, chimeras, flow cytometry, etc., etc. You can as many as you want here. Number 4, which method of training would you be most interested in? Face-to-face, video. We know that face-to-face is becoming very difficult, but we hope that we will recover it in the future. Video, internet, reading, others, and we included 2 questions of free text. The number 5, that is if you know of any other education and training program already running, because we can use it. We can share the programs that are already working. We don't need to create everything from scratch. We can use this platform that have been running for years and are very useful in your center or your previous network, and we can use it also in TransplanChild. So this is free text. You can specify as many as you want. And number 6 and last one is if you have any other comments. For the survey, it's very difficult to analyze later if the questions of free text, but they are very interested because you can tell us what you really need, what you really think about your hopes and your expectation from the education and training program. So this is all. Summarizing, this is a survey for all TransplanChild members. We are going to elaborate the education and training program for young trainees. Again, it's less than 5 years working in transplantation for clinicians and less than 10 years for surgical specialties. When you finish this survey, that it will take about 5 to 7 minutes, more or less. You just click, submit, and this is all. So thank you very much.